All right, I've already checked my order, so I will be doing a chest tube dressing change. After I come in, I would want to provide for privacy, wash my hands, and before I came in this time, I had already gathered my supplies, so I'm all prepared, including a biohazard bag to put my old dressing in. Hi Mary, my name's Michelle. I'm going to be your nursing student today, and I saw that we have an order to do a chest tube dressing change. Is that okay with you? She says yes. Before I do anything, can I have you verify your name and date of birth? And what she says is correct because it matches her band and the chart. Do you have any allergies that I should know about, especially iodine? She says no. Okay, Mary, thank you. I just wanted to double check and verify that. So next what I want to do is explain the procedure to Mary. So have you had this done before? She says yes, so you know what to expect. I'm just going to palpate around, check everything out. I'm going to take that old dressing off, clean it all up, and then put that new one on. She says yes, she's been through that. So are you going to be able to hold still for me? She says yes. So she's able to understand commands. So Mary, I'm just going to get a few things ready here. So my hands are still clean. So I'm going to put my clean gloves on. And before I start this procedure, you always want to do your assessment first. So assess your chest tube, drainage, anything like that, and complete a respiratory assessment. So now that my gloves are on, I'm just going to, Mary, I'm just going to lift up your gown here quick. I gotta check everything out. So I'd want to palpate for crepitus. I don't feel anything on Mary. But if I were to feel some, I would want to mark on my new dressing once it's placed with a marker around where I noted the crepitus, or per facility policy. And I would also want to note that a small amount of crepitus can often be found with a pneumothorax. So you'd also want to note that in your assessment. So for right now, I'm just going to anchor this tube here, peel back this old dressing on the outside, working my way in. How you doing, Mary? She says she's doing pretty good. She's been through it a few times, so she's a champ. Rid of that. All right, and then this would want to go in the biohazard container, but before it does, I'd want to examine the dressing for the color, odor, consistency, characteristics, and the amount of any drainage present. So I would throw this in the biohazard, but I'm going to set that there for right now. And then on the site of insertion, I want to examine for any redness, edema, ecchymosis, drainage, and the approximation of the site. So next I'm just going to remove my gloves, wash my hands quick, and get my cleansing solution ready. And I had already checked the expiration date on that, and it's within range. All right, and I want a sterile cup. And depending on facility, you might use normal saline or just regular sterile water. Pour above. Put your cap back on. All right, and then you want to use your cotton tip applicator, so you'll open them up. Grab the ends. The tips are still clean, so you want to just drop them in. Throw this in the regular garbage. Grab your next one. Drop those in. And then my hands are still clean, so I will put clean gloves on again. And I would want to cleanse around the site. So I want to work inside out. I would throw this one away. Grab my next one. Inside out. Next one, inside out again, and my last one, inside out, and then I would throw these away, and then once that is dry, I would apply skin prep, or depending on facility policy, or if your patient has a sensitivity, you want to apply that where the adhesive tape is going to be sticking. You don't really want it right inside because the patient doesn't need that. So I would throw this away, remove my old gloves, just move that over there, wash my hands. How you doing, Mary? She said she's doing pretty good. And then I would want to open up my sterile dressings. So I want to move my table just a teeny tiny closer. Touch that, I want to cleanse, just in case there might have been something on the table. All right, so I would want a Vaseline or petroleum gauze. Your drain sponge, and then your 4x4 gauze. All right, and then I want to grab my sterile gloves. Just being cautious to make sure none of the paper touches my sterile dressings. So I want to apply my sterile gloves. Making sure that didn't touch that. I was watching that. These on. Grab my next one. And I will be using my Vaseline gauze first. So we'll grab that. And I'm just gonna go under here, making sure not to touch anything. And I'm just gonna drag this up. Just kind of move it around here, making sure that's nice and tight. I will grab my drain sponge now. Place that, and both my hands are still sterile. Put that on, and then grab my 4x4, place that on top, and then I will grab my tape, and I don't want to touch the inside of the tape because that is what is going on top of the sterile dressing. Just want to use the very outside of that. Place it on, not touching the dressing. Grabbing my next piece of tape, if it'll come off in one piece. You know how tape is, it never likes to cooperate. Alright. Grab that here, that one on. Still not touching that sterile dressing. Then we will grab our last piece. And you want to create an airtight seal with this tape, and also having just extra dressing stuff by the bedside is also very important. So now I can remove my sterile gloves, clean up all my supplies. I want to wash my hands. And then I'm going to pull Mary's gown down to make sure she's comfortable. I would want to make sure my patient is safe. And before I leave the room, I want to mark my date, time, and my initials on the dressing, so they know when it was changed and who changed it. I'd want to make sure the bed's in low position, cull it within reach, my patient's comfortable, rails are up if they need to be. Dispose of all my supplies in the proper area. Anything in biohazard goes to biohazard. If this was a child, I could have a parent present or another staff member to comfort them. Then I can always medicate before the procedure. And then I would want to document the date, time, any assessment findings that I may have had, and if the patient had any issues with the dressing change at all.